Hi and namaste, everyone. Recently, some of my patients wanted to know more about a CT scan and what are its possible adverse effects, if any, and what are the circumstances we use. I am your radiologist, Dr. Madhav Hegde, and I would like to share some useful tips on CT scan. CT scan, also known as computed axial tomography or computerized axial tomography, or simply put, computed tomography, and abbreviated as CT scan. CT scan is one of the tests used by radiologists along with ultrasound, MRI, PET scans, and the likes to come to a conclusion on diagnosis. And it is also used for screening purposes and also to confirm the wellness of individuals. In general, it is suggested or prescribed by the medical professional you have consulted. Medical professionals may be either from modern allopathic stream or they may be from alternative system of medicine. Then what are the types of CT scans we have? We can classify it in 2 or 3 types: basic and advanced CT machines, depending on their technological capabilities. So when we call advanced, generally we are talking about CT scans which are called as 64 slice CT or 128 slice CT or something above. These are needed to do advanced tests like angiography or heart or cardiac CT. Whereas the other parts of the body like head, thorax and abdomen, neck, or the ENT region, or even the legs or the arms, they can be done by other kinds of CT equipment, which need not be as advanced as 64 or 128 slice CT. And they can also be classified in the way we carry out the test. Sometimes CT scans are done under emergency conditions, as happens in the case of accidents, or sometimes we can plan them after good preparation, because good preparation gives good pictures so that our interpretation and the diagnosis is more accurate and reliable. In case of abdominal CT, we need preparation of bowels. Similarly, when we are planning for cardiac or coronary CTs, we need to plan overnight. There are occasions when individuals themselves have concern of a malignancy, that is a cancer, or some kind of heart ailment. In this scenario, in consultation with medical professionals, we can do a dedicated CT scan of particular system to screen for the illness or to address the concerns of the individual patients. The other type of CT scan is plain scan versus contrast scan. In case of contrast scan, we use a drug, that is, we use a medicine to make the pictures more brighter, more reliable, and with better contrast resolution. So these contrasts are iodinated contrast, and we inject it through an IV cannula placed in the veins. So what we need to notice is this drug, what we call contrast, is injected through the veins, not through the arteries, because they behave in a different way when we inject it through the veins compared to arteries. So this one thing, both we radiologists and other professionals in the imaging field emphasize when we consult a patient undergoing imaging studies. Because when we inject contrast through IV route, that is the intravenous route, there is a risk of allergic reactions. And we also need to be concerned about the rare possible chance of having a serious adverse allergic reaction. So patient or the individuals undergoing a contrast CT scan should know and ask relevant questions before undergoing a CT scanner. Generally, it is a technologist or a nursing staff the patient first consults during the CT scan. So these pertinent questions will help the patients as well as the imaging staff to prepare for the inadvertent allergic reactions if anything happens.